Good afternoon, ladies and gentlemen. This is an unusual sort of narrowing, long audience, quite different to what we're used to in the House of Commons. It's sort of long, thin that way, and you're very close to each other. So I can't see you down the bottom, but I've sat down there so I know that you can actually hear us. It's my pleasure to join you today to talk about what I think are some of the most important policy areas that politicians can seek to understand and get right. I can see from today's agenda that the themes you've been discussing have been wide-ranging, and the speakers you've been listening to, especially Marcus that I've just heard, and will be listening to after me, are all very distinguished and knowledgeable on the individual subjects that they've been addressing and are going to be addressing this afternoon. I'm particularly sorry I cannot stay around for after this session to listen to Alison Garnham and Naomi Eisenstadt. The latter's recent book I couldn't put down on Sure Start, as well as the speaker from Ofsted also, who will be discussing the regulation of early years provision. I'm sure any childminders who might be here today will be keen to hear any insights into the inner workings of Liz Truss's mind, if indeed they are forthcoming, and whether the new minister thinks he will be able to deliver the kind of quality support for young children that we have come to expect from all childcare professionals if you've got 5 toddlers to contend with at any one time. I could speak at length on the children's workforce and the importance of tackling child poverty and health issues like obesity and malnutrition, which we're seeing more of now, but I've been asked to focus my contribution today on improving services for children and young people, particularly around early intervention. I think it's important when we talk about what should happen and what various agencies need to do, we need to start by asking, why are we talking about this? Why is spending on children a priority at a time when the economy is stalled and police are being cut back, the DFA is looking to sack half of their workforce, and 1,000,001 other programmes across the government are desperately in need of cash? As much as it can be very frustrating at times, I'm quite realistic that there are a number of issues competing to be at the top of the political agenda, with the economy and public spending near the top. But early intervention and prevention need to be distinct from those issues. In fact, for me and for Labour, I believe it should be central to building a sustainable and fair economy, and it should be central to how we make the most out of public funds, especially when there is less money around, as is likely to be the case for some time to come. Those of us who take an interest in this area of policy will be familiar with the picture that Graham Allen used on the front of his second report, the cross-sections of the brains of 2 3-year-old children. One of those brains is of a normal, healthy, well-nurtured child. The other, which is significantly smaller and less developed, is from a child who has been subject to severe neglect. The difference between the two is the best demonstration I have seen of just how important nurture in the first couple of years of a child's life is in determining their life chances and how damaging neglect can be. If we believe that improving the life chances of children and young people from all backgrounds is fundamental to the future of our country, which I certainly do, then we need to look seriously at why that neglect occurs and what can be done to tackle it. We've had 2 excellent reports in the last couple of years commissioned by the government but compiled by the Labour MPs Frank Field and Graham Allen. And we've had no end of warm words from ministers, even David Cameron himself. But what has been the reality on the ground for these services? Well, because the government lumped together a load of funding for various early intervention programmes and then bottom sliced 20% of it and then removed the ring fence, you know the fund I'm talking about, the early intervention grant, we are starting to see a real reduction in the support available for families. At the last count, there were 281 fewer children's centres than there was in May 2010. And in many areas, the ones that remain are being hollowed out. Councils are also being forced to scale back things like training for the early years workforce and subsidising highly qualified staff in childcare settings, which the Sutton Trust recently highlighted as key to ensure that early years settings narrow the gap for poorer children. And any of you who work for a local authority may have been on the receiving end of a freedom of information request from my office over the summer, the results from which are still pouring over at the moment. But the initial indications show a drop-off of nearly half of all spending on workforce development because of the changes to, and specifically the reductions in, funding. As another aside for any childminders who may be in the room, I had to laugh at last week's announcement by Maria Miller of £2 million to provide grants of up to £500 for new providers setting up to help with registration fees, she said, and health and safety training and things like that. Exactly the kind of support that many local authorities already provided, but have had to cut back on due to the cuts. And this £500 may be a big help to childminders, but against the set-up costs for a nursery, which she said it could also be used for, it's just a drop in the ocean. And you can't really blame local authorities for targeting those kinds of spending programmes for cutbacks. Despite what I said earlier about children's centres, in many areas they are being preserved following protests from parents, and the cuts that we have seen have certainly not been as great as feared, given the funding reductions that councils have received from central government. But when more than £1 billion is being removed from the early intervention grant over the 3 financial years we've had since 2010, cuts have to be made somewhere. And even though there are duties to develop the children's workforce, and even though a well-qualified workforce is so important to a child's development, workforce development is an area of spending which largely goes under the radar of voters. And of course, that's just the start of it though, as we learned recently that the extension of free childcare for disadvantaged 2-year-olds, which we had always been promised would be new money, is actually going to come out of the existing early intervention grant pot, which is going to then be wrapped up in the general revenue support grant. And if that wasn't enough, the government are also planning to hold back £300 million of that money over the next 2 years for central purposes. I haven't said what, probably payment by results of the Troubled Families programme, which itself, again, was supposed to be extra money and new money to what councils were already doing. The upshot of that is the notional early intervention grant in 14-15 will be more than 40% lower than it was in 10-11 before the election. 40%, and all that work still has to happen. As opposition politicians, both myself and Bev can campaign against those cuts all we like, and we have done, and we will continue to do so. But given the latest rounds of cuts, even Conservative councillors are coming out of the woodwork to call the government's approach short-sighted. But for now at least, those cuts are here to stay. We are therefore looking to our leaders in local government to ensure that they are doing the best they possibly can for all children and making the right choices where we have the ability to make them. That's where the kind of targeted interventions which organisations like Wave Trust and Oxpip advocate come in. High impact programmes which genuinely turn lives around. But having targeted programmes in place is no good without the universal front doors and graduated responses that services like children's centres provide, because without them we struggle to find the families that are most in need. I think the government needs to learn from the kind of data sharing and co-location of services that some areas are already doing well, and make sure that that practice is spread across the country as a matter of urgency. I visited a Sure Start Centre in Manchester at the beginning of this year to meet the professionals who are redesigning the whole of the service there, the early intervention services across the city, and to discuss how they reach those families that they've always struggled to before. After lengthy negotiations, they told me, the NHS agreed to let them have a paper copy of the live birth register, and that a nominated person had to go and collect and then manually enter the details into an unnetworked computer, then had to shred and destroy the paper copy. I mean, that's just a ridiculous process in this day and age. Seemingly it was all about data protection. But it means they get the information which then allows them to go out and encourage parents to come and access the services available. And Many of the other children's centres and other services I've visited across the country, the majority in fact, haven't been so successful at getting hold of this information. So they then have no ideas which doors to knock on. They're relying on anecdotal information of where the babies might be. That has got to change, and I hope that the forthcoming Children and Families Bill may provide me and other colleagues, including some on the Conservative benches who are very passionate about the foundation years too, with an opportunity to make the case in Parliament for a statutory duty to ensure that frontline children's services get that information. But even if you know where the children and the new parents are, you're unlikely to be able to build up a relationship with them if the services you are pointing them towards don't provide anything they want. Unfortunately, that's the reality in many centres at the moment and will increasingly spread to other centres as the next round of cuts begin to bite. 4Children's recent Children's Centre survey found that 20% of centres are starting to charge for services that are formerly free. 55% no longer provide any on-site childcare. If parents don't go to children's centres because they can't afford the services they want or they're simply not available anymore, that means that their children won't interact with the early years professional staff who might be able to spot problems like disorganised attachment or other things and won't be able to refer the family for targeted intervention services which could help them. That's why I like Frank Field's idea of greater co-location of local authority services, welfare, housing, NHS services and registering births, all within children's centres, ensuring that there is a reason for every new parent to come through the front door, to meet staff and to see what they could get out of their local centre. To be honest, I think we could do even better than that and say there should be a reason for expecting parents to go to their local centre to access prenatal services, both so they can see what's on offer there and so that staff can suggest any sources of help or support they may need before or indeed after the birth, such as financial or mental health support. I recently met with the Innovation Unit who do a radical efficiency programme, which some of you may come across. I would recommend getting in touch with them, and they've got some amazing ideas for how we can do more with less. Also, I should mention the role that volunteers can play through this radical efficiency programme that they advocate, and also Action for Children do some amazing work using volunteers as well. But coming back to why we need to do this, there are two clear reasons why the government should focus on prevention and early intervention. Because they have a moral duty to improve the life chances of the most vulnerable children, and because we want to build a stronger and more sustainable economy for the future. We know that a poor first couple of years, and by poor, I'm referring to the quality of relationships and experiences, but in the first instance, but we should never forget the role that poverty can play in this too. That those poor first couple of years can have such a significant impact on a child's outcomes in later life. They're more likely to have health problems, more likely to have language delay and communication problems, more likely to be behind when they start school and then stay behind throughout, more likely to engage in risky behaviours such as violence, drinking, underage sex, drug use, etc. And more likely, unfortunately, to end up going through the criminal justice or care system, and less likely to gain good qualifications and go on to further or higher education, and therefore more likely to be unable to hold down meaningful jobs or relationships. It's quite important that we get those first few years right. We then come full circle because those individuals are then less likely to be able to provide the kind of secure attachment that their children will need to have a better chance at life than they did. The human side of all of that is bad enough, but there's also the cost to government, the financial side, and therefore to everyone else, of all that support that they and their families after that will need throughout their life. The moral and financial imperatives for investing in prevention and the earliest of early interventions are therefore one and the same. Investing in early intervention has been proven time and time again to deliver financial and social returns, sometimes huge, which benefit the whole of society. Just as one example, the return on investment of the family nurse partnerships in America was calculated at up to $34,000 per child by the age of 15, and that's a ratio of 5 to 1. I asked Graham Allen after he published his report what was the #1 intervention programme if he had to pick one out of the list he recommended, and he said family nurse partnerships. So on the strength of that, I went to shadow a family nurse for a day to get an idea of what they do and the support they provide to young mums. And even though it was very much sort of by the textbook that was laid down and based on set guidelines, the support that those professionals provide was more like the kind of friendly advice that many of us got as young parents from our own mothers or from grandmothers or other family members when we had our children, but which these parents just obviously weren't getting for whatever numerous reasons. And it was easy to say how priceless that kind of intervention is and how it will end up paying back the investment it needed many times over. But intervening early doesn't even need to cost as much or even be as obvious as programmes like family nurse partnerships. The same kind of parents who we target with family nurse partnerships could also be helped by simple things such as recognition of parenting as an essential skill in our education system. I think, and I know this is an idea that Frank Field is keen on too, as well as lots of other experts in the sector have bounced this idea off, that child development and practices which promote positive attachments between parents and their child should be taught throughout the child's whole learning journey and throughout the curriculum, by lacing the concepts and science which make for good parenting throughout a pupil's school life, particularly emphasising the scientific evidence on the importance of the first 24 months of a child's life, emphasising the devastating impact that neglect can have during that period, and the equally devastating impact that smoking, drugs and drinking can have during pregnancy. We can give these pupils genuinely useful knowledge that will help them give their child the best start in life when that time comes, which hopefully will be a number of years later. Whatever their economic situation will be at the time when that time comes. The debate about whether prevention programmes work is over. We know they work, and we've just got to get on with doing it. Graham Allen published a list of his top intervention programmes, and I think that's something the government could do too. Stephen Twigg has talked a lot about an independent office for education improvement, which places the onus on evidence-based programmes rather than political wins. And I think that could be extended to cover early intervention. Acting as a kind of clearinghouse, but also as a way of sharing best practice. Alternatively, we could look to the Early Intervention Foundation, which I'm pleased to say is looking slightly nearer now, as a consortium led by Graham Allen has recently been announced as the preferred bidder to run it, to provide an ongoing assessment of the programmes that are out there, as well as being an incubator for innovative but as yet unproven ideas. Wherever it comes from, we need an authoritative body with the expertise and ability to give local authorities the confidence they need to make the switch from concentrating on solving the problems when they occur and become a crisis, which we'll always have to do, to investing in trying to ensure that those problems don't occur in the first place. So to draw my remarks to a close, I've outlined just a few ways in which I think that children and young people's services could be improved to place a greater emphasis on early intervention and prevention at the heart of what they're about. And I certainly don't have all the answers, but I am, if nothing else, a determined advocate for these services. If for no other reason than because I've seen the impact that they are having now. And while everyone's struggling for funding, and that it gives me hope that the quite utopian vision of people like Graham Allen, Bev, myself, and many others in this room can be achieved given the right support for these services from policymakers. And we've got a Secretary of State who thinks, and I'm not making this up honestly, he said in Parliament and outside of Parliament, that early intervention means converting primary schools to academies, against the will of parents and staff often, and a new minister who thinks the answers to the childcare crisis we face is to deprofessionalise the workforce. Being an advocate from the opposition benches can be very frustrating. But I will continue to plough this furrow both inside and outside Parliament, and I welcome definitely opportunities like this to engage with people like you who are actually involved in delivering these crucial services to hear what you think the government's priorities should be in this area. Thank you.
Thank you, Sharon. Where's Marcus? Would you like to come up here, Marcus? Okay. Two contributions that, from very different perspectives, but which I think were both focusing us on some key issues. I think firstly, how do we get in early to promote well-being for our children, from birth onwards, as Marcus was showing. Secondly, how do we do that in ways which harness and develop rather than extinguish the innate creativity, curiosity, problem-solving approach that children have? And thirdly, within that, how do we identify early those children within the context of universal services who, because of family circumstances, health or disability or whatever, actually need extra support and intervention in order to achieve their potential? So that's my take on the common issues that run through both Marcus's and Sharon's contributions. So I'd like to open the debate up for you now, and let's see where we get to. Okay, I'll take 2 or 3 points and then I'll ask them both to contribute. So a lady there, and there's also a lady at the back afterwards. Thank you. Can you say who you are?
Hi, I'm Paid Head of Child Studies at York College. Listening to Sharon speak, it was like stepping back 20 years. I started my career 20 years ago as a development worker with a local council. Show starts, National Childcare Strategy, everything was in place, the funding was coming rapidly, it was absolutely brilliant time to be involved. And it's such a shame that things are disappearing, because like you said, that is the answer. And so I just hope you keep banging your drum and keep going with it. I'm now in a position, and I feel in a privileged position, to have experienced the early years end, which I think some of the answers to your problem, to your question as well, is the early years foundation stage curriculum, which anybody familiar with the new version will see that there is the problem solving, there is the switching of young children on for the futures. Unfortunately, I'm at the other end of the spectrum now, and I'm absolutely inspired what Marcus had to say, that I'm now working in a further education college, training future childcare workers who are uninspired, totally switched off. The 5 A to C's mean absolutely nothing. They can't string a sentence together, they can't have a telephone conversation. And I would love Marcus to tell me, how do I switch them back on so that they can be inspirational for the young children at the other end?
Well, you very neatly linked those two populations of people, but in a very profoundly important way, actually. I'll just take that lady from the back as well, and then bring Marcus and Sharon in. Just there.
Thank you. Hi, I'm Kath, and I'm a children's nurse by background, and I thought that the last 2 presentations were absolutely superb, so thank you ever so much. I'd really like to ask, how can policy support us more effectively in actually joining up health with education in a really robust way? And I thought that the discussion that you actually made, Sharon, about actually investing in our young people to make a difference to the children of tomorrow was a really great point, very, very well made. And that's where I'm really interested in Marcus's perspective, really, on health and how we actually engage our young people in becoming more self-caring in interventions, because some of the costs that we're actually seeing within the health service are going to be unsustainable. So we need to think and do differently, and I really value your comments on that.
Thanks, Marcus.
Well, I have to say, because I don't run a huge organisation and I've never managed to get any funding from anywhere, I tend to use the approach of trying to set up a positive virus. You know, there's something wonderful about a virus, and it just spreads. Quite a lot of them are negative viruses, but if you can get a positive virus spread, and it'll mutate, and it'll become something else, but it will self-generate. So that thing I showed you about films, you know, primary school kids making a film about their village. The next thing is make a film about health in their village. reach. The next one is make a film about the hospitals and about the care. And what we start doing is we start getting kids themselves getting interested. And as they get interested in beds, the question about childcare and about some people who look after children is that quite often they themselves aren't aware of the opportunities in the world. So why don't they both use that as an opportunity of discovery? You know, there's something strange. I'm an adult, therefore I know. Kids, I teach, therefore I don't. What becomes very powerful is to have a joint learning experience. So we both learn. And that is sometimes a wonderful way of connecting these dots. Every time we've found people starting to do that, they accidentally pick up sponsorship and revenue. It's an accident. You know, it's a bit like a cinema shows a film made by some kids, and they say, would you make us another one because we don't have any B-movies? And then the kids go, well, yeah, you have to pay for it. And then you find that 10,000 quid goes towards the kids for that project. And then there's a 50,000 quid which goes to them. So it's a sort of a way of, because there's a lot of money in the system, it's just that it's in different places. So at the moment, money's going to schools, isn't it? More than necessarily authorities. But schools don't know what's possible. So dump it into the curriculum so that people get assessed work and it starts coming together. But actually, the best people to do that are the children. So that's what we have tended to find, set a positive virus in the kids to let them start doing it, and sort of sticky balls start attaching to it. Does that sort of get any form of thing? So we started off with three schools doing movies. There are about 300 now. And so maybe that'll be 3,000 next year. And then something will mutate into something else. And I think that's quite a nice way of doing it. When you, otherwise you spend all your time trying to get funding. And if you've ever tried to get funding, it can be as long to get the funding as to do the thing you were trying to get. If you had the funding, you'd have done it. Anyway, that's my take.
Sharon. Anne, was it Anne? Yeah, stepping back 20 years, isn't that quite sad? That how many times have we got to come to conferences like this and talk about this subject and what needs doing, and have Graham Allen and Frank Fields in the future doing these reports the argument surely has been won. And when Bev was a minister, a children's minister for 4 years, she was part of rolling out Sure Start and trying to get a whole network in place where a lot of this early intervention could happen. We all understand that if a child's behind in those early years, they just never catch up. And even a bright child who at 7, I mean that famous diagram, a bright child at 7 who was above their peer at 7, it will totally swap as their life moves on. And we've got to turn that around. We need those children to have as many skills as they can, as early in their life as they can, and for any problems to all be ironed out. We know all of this, so how frustrating it is. I share your frustration. I don't want to be coming back to something like this even in 10 years' time and having these same conversations. We really need government, and for people at the top of government to really get it. We were so hopeful that Graham Allen's report would do that, and that it would be jumped on. And I know there's the foundation, but they've only got a budget of about £3.5 million. Again, these are drops in the ocean, and we need, if they're going to look at what's out there and evaluate it, we then need government to put the money in for what they then go on to find to be implemented. Or otherwise we'll just keep having reports about what should be done, but it never ever gets properly funded to be done. So I've got lots of ideas for when we get into government, some of which I can't share with you today, because they're still being formulated, about how we could find the funding to do some of this stuff. And it wouldn't involve the social impact bonds and innovative ideas that Graham Allen come up with, was trying to get some private finance, people to lend the government money to do some of this money, and then they'd get a social, they'd get some return on their investment and stuff. It was a good idea, but the money's actually not coming forward. People, the trusts and other ones, equity firms and different things, they're not coming forward with their millions, saying, oh, well, we'll invest in this and let you go and run with it, and then we'll get my money back with a 7% return if it works. They're not really coming forward with that money, so we need to do it another way, that we need to do it as a government, and hopefully we will when we get back in. What you mentioned about the young people in FE and inspiring them, how to switch them back on, I think, you know, all the reasons you said, we know why they're where they are, but some of the reasons is what's being fed to them. They've been told the hair or care, you know, narrative. Yeah, so they've been told that's been fed to them, who by their teachers some of the time. That when you go into hair or care, the status of the profession. You've got to start with that. We don't want teachers who want to become a hairdresser or go into caring. That caring should be, you know, a much higher status profession, and it needs to start with teachers and educators talking about it differently. You know, it's so important, the work. We know that. We all know that. Teachers should really know that. So we need to challenge our the teaching workforce and say, you know, you've got to talk about it in a different way, because then when a young person finds themselves in FE studying to be a young, you know, to work with the workforce, the young people's workforce, the early years workforce, in the back of their head they're thinking, I'm a failure. So as much as you're trying to train them to do this vital work, somewhere back here seeds have been planted that say, if you'd been a bit brighter, you could have been trained to be a teacher, you know, here you are, do make the best of it. We need all those seeds to have been planted in a much different way. So that was what we were trying to do with the earliest foundation status, raising the status of the profession, having a pedagogy, you know, when you go to Denmark, they're all degree level. People who do this work are all degree level and they're paid accordingly. But how do you do that? I've just got one thing I wanted to say about Kath. About Kath, who said, I think we need more school nurses. I know you said you were a children's nurse, but I definitely think we need more school nurses. That would help to join health and education. And also, we need to break down the silos between health and education. That needs to start at minister level by having somebody at cabinet level, I even think, with a foot in both the Department of Health and the Department of Education.
Thank you, Sharon. Okay, a couple more points. Yes, that lady there. Anybody else? Final question after that? Yes, Jan down.
Good afternoon, I'm Kim Taylor. I'm a head teacher of a special school in Cambridgeshire. I'd just like to invite Sharon in particular to comment further on what she said about the charging for services for children's centres and Sure Start. I'm very concerned, especially about the new sort of things that are going to be happening within social care, and also things that are also happening in terms of benefits and things that are happening that will have a huge impact upon parents in particular. And whether this in fact will actually make some people be more disconnected than they have been in the past. And that's my main concern, that these people are not going to become more isolated because they will not be accessing the services that they had been previously. And I know in my area they're very concerned about that, and a lot of things are being done voluntarily to make sure these things are being continued because they're so passionate.
Thank you, Kim. Last point here from Jan down here. Can we get the microphone down to the second row here? Thank you.
Thank you. Jan Tallis from School Home Support. Yeah, great to hear you both, and really inspirational, and really wish we could give a bit of that to every child, but also, again, to their parents. The parents are going to be inspirational for their children, because that really matters. It's so disappointing to hear about the cuts in the early intervention service, and we're starting to work at the other end, really. We used to work very much early intervention. We're now also looking at troubled families and the complications that have already set in there. And, you know, as my colleague put it, surely it's more humane to stop them falling off the cliff before we go and scrape them off the bottom and put them back on again. Just slightly on the social impact ones, we've been investigating this, and it is fascinating. You've got to have really strong outcomes data, and you know, what you're going to be paid for doing. And actually there is finance out there for it, there's plenty of it, but what we can't find is the commissioners, because from where we work, we'll have an impact certainly at the school, but really the real payback is stopping kids getting into the criminal justice system, stopping them doing it. And so the people who might be paying for it won't be the ones who get the savings from it. And I think that, you know, just listening to Westminster Council talking about the work they're doing with their family recovery unit, the chair of the committee looking after that, you know, a Conservative, is absolutely furious with her government about how they're cutting away her ability to make those savings, and the fact that recognising that they will carry on doing it, even though as a local authority they are unlikely to get the financial benefits of doing that.
Thanks, Jan. Right, some final comments?
Right, and I'll try and be brief. Jan, parents need to be aspirational. Yeah, definitely. One of the things that I'm always quite shocked by is, you know, the kids all start off with huge aspirations, especially, they're all level. When you talk to kids in a primary school, you know, they want to be a doctor, an astronaut, a footballer, a hairdresser. They see everything is the same. You know, they don't see the status in any of that, or even, you know, what you might need to be an astronaut or a brain surgeon, or, you know, whatever. And that changes when they get to primary school. Secondary school rather, when they move on and they become more self-aware and see where they fit in society, and maybe are picking up the lack of aspiration from their parents. But what I find so interesting is immigrant communities. It's not the same. White working class communities, there's no aspiration at all in lots of them that I've come across. And yet, you know, people who come in from the Caribbean, for instance, there was one guy I met who was a councillor in London, and he'd come here in the 50s and 60s, and his children went on to be a barrister, a teacher, and a doctor, and he was a busman, he was a bus driver. But the aspiration had come from him for those children. And I think, so why can't we have that in our poor working class communities? Just because, you know, everything wasn't right for them, they should have huge aspirations for their kids. Those kids to have the same opportunities as George's kids, who, you know, were born here and had all the opportunities that this country can, you know, provide through the education system. So it starts with the parents and what they've experienced that influences that, you know, the messages they're given to the kids. And teachers in school can try to put some of that right, but it shows the influence they're getting from home really is what drives it. So we need to do something about that, which is working with the parents, which is where Star came in again. The other point from Kim, yes, charging for services in Start, and people will then, you know, not be able to access them and start becoming isolated. I totally agree with you. And what we need to do is, you know, we've got to try and forbear as much of these cuts as we can, and that's the job of some of you guys here, to try and protect some of these services as much as you can until, unfortunately, we get back in. And, you know, we can't reverse all the cuts overnight, but our priorities will be different. And, you know, we've just got to work smarter, and that's why I mentioned working with volunteers and the innovation unit. It's amazing. You know, those volunteers, it's not about saving money, it's about reaching more people. And so I'd really encourage you to look at the work that they do.
Thanks, Sharon.
I'd just like to bring it down to the personal level. It's quite a tough thing, actually. In a lot of deprived areas, I spot an awful lot of teachers who live in a nice area commuting. So they don't necessarily know the area. And then we have safeguarding, which means we have to look after young people, so we make sure it's difficult to get into the school. So what you end up with is you end up by saying, come to our school, and you've got to go through double gates, press a double door, press a buzzer, and you can't take pictures of kids. So it's not exactly made easy in a primary school for parents who do have aspirations for their children. Of course they do. They're the most important thing in their lives, positively or negatively. But, you know, if we make life difficult to access the very people who want to help, it doesn't make life easy. And then we get a set of attitudes. Now, I come from a broken home, and my father killed my mum. So, statistically, I should have been in prison. But I didn't tell anybody, and my school didn't have the data, therefore I was treated like anybody else. I think it becomes quite difficult, actually, when you give people too much data, because then they start believing it. And then they start approaching you with a different attitude. And I'm not convinced that we then look at people as people. So I'd like to bring it right down. So if you just go to the average children's centre, you may not find, as you walk down the road and you see lots of kids having a good time, you'll probably find officers at the front because the kids are at the back, because of safeguarding, because of protecting. You may find if you go to the average primary school, you can't get in. So it's difficult to access this stuff. You may find that the car park empties out with all the teachers driving home, not walking through the same communities. So it's not as if we're making life easy to say we've got communities looking after communities to help the people who are less advantaged in those communities. Quite often in primary schools, it's the teaching assistants and the support staff who live in the communities, but because they're called teaching assistants and support staff, we don't want to give them too much responsibility. In the same way as if you've got parents and they've got children who've got a major issue, you may find that they don't talk to their children, the children hear them being talked about, because they're a problem. You know, we've got to take them to here and take them to there. So I like taking it right down at the human level. And I spend my time in pubs, in deprived areas, and I know someone has to do it, and just talk about children and opportunities. And very often, they just don't know what opportunities there are. So we just have to help them and show them. And you know the best people to do that are their kids. So maybe we're making it all a bit hard. Anyway, all I can say is that we probably talk to 100,000 teachers and students a year. And you do get this thing happening, and you do see viruses starting to spark off. And everybody in this room will know some people who do fabulous stuff, might not be allowed to, but it's fabulous. The more of us who do that, the more likely we are to get the ball rolling. And that's all, really, I'd like to say, because I think it genuinely is a little bit easier than we make it appear, because we're adults and we get too nervous about us making a mistake. Well, let's just leave that, and we get up from our seats. Let's go do something.
Thank you, Marcus.